Investigations by Open Democracy have revealed that COVID-19 restrictions have resulted in avoidable deaths of women. Some women were forced to resort to unsafe births at home due to transport restrictions. The investigation was looking at 45 countries around the world, including 6 in Africa. Let's chat more about their investigation now with Open Democracy Africa editor Lydia Namubiru. Lydia, good morning and thanks so much for your time. Very, very disturbing findings indeed. So you found that there's alarming evidence that these pandemic restrictions have caused deaths and unsafe births. How? What's been happening?
So with lockdowns, so first of all, before the lockdowns, generally African women did not count on the government to provide them transport or to provide them with any means of connecting to hospitals. But what a number of African governments did is to ban even private passenger transport. So in countries where there are no ambulatory services, women found themselves unable to even hire private cars to travel to hospitals, and that not even just cars, but even motorbikes were forbidden from carrying people to hospitals, and this resulted in a number of deaths. Number of deaths in Uganda, I think right now we're learning that even official statistics show that in March, when the lockdown and the transport ban first took effect, we lost about 20 more women. This is even more than our investigation captured. What we're finding out from official statistics is more than what our investigations covered. But the same things happened in Ethiopia, in Kenya, in Sierra Leone, in Zimbabwe. Governments chose to restrict or ban passenger transport without providing adequate means for hospitals to refer women who need emergency obstetrics care, or even any means for women to leave their homes and go. In some cases there were exemptions, but then to take advantage of the exemption was really difficult. For instance, in Uganda, you had to get a letter from a representative, from the local representative of the president. This is someone who serves maybe 500,000 people, and in an emergency, you had to obtain a letter from them before you could get into a vehicle and travel to hospital.
So Lydia, transport seems to have been one issue, but I'm also reading here where it says that in some cases health workers have actually refused to treat pregnant women who actually did manage to make it to hospital, and that is indeed very, just as worrying.
Yes, and indeed we know at least of one case of a Nigerian woman who died. She had what health workers thought were COVID-19 symptoms, and indeed she did test positive for coronavirus after the fact. But in the meantime, while they waited for her coronavirus test, they left her unattended for 4 hours, and she eventually died at a hospital in Nigeria. But you also have hospitals that decided, women's health hospitals that decided to cut down admissions and keep patients out, presumably to decongest, without offering any other options where women should go. And so women found themselves, being turned away at the gates of hospitals.
I mean, just also looking at how some of them, other than those who were refused refused treatment, just those who actually went to hospital, and this is, across Europe, Latin America, and Africa included, just the treatment that they actually received in hospital, and just, things like giving birth without support because their companions obviously were not allowed to come, forcibly being separated from their newborns. They weren't allowed to breastfeed. Medical procedures, including C-sections, inducing births, episiotomies to speed up the labor, and then not being able to get pain medication, of course, because the hospital says it didn't have the resources to do so. I mean, do these women actually have any recourse? I mean, and you're looking at countries where, it would be a miracle, I suppose, if they were able to sue somebody successfully.
Well, it's difficult to tell. I think human rights lawyers, for everybody, this is a moving situation. Human rights lawyers here in Africa are saying they will go to court where restrictions lead to deaths. And I imagine some of that will happen elsewhere in the world. But yes, I think in principle, human rights lawyers say this does qualify in many cases as discrimination, and women should at the very least try to obtain some form of recourse.
Is the World Health Organization in any position to help them?
The World Health Organization was quite proactive about this. As soon as the pandemic was declared, about a week after the pandemic was declared, they put out guidance that in fact was the basis of our investigation, saying women should not be separated from their children, from their babies, even if they are positive. Women should have a companion of choice. These are old regulations, these are old guidelines, but they republished them to emphasize this point. So I think it was really up to the national governments to ensure that they stayed in line with those. And what we're seeing is that very little of that.
It's indeed heartbreaking, and very little that anyone can do for them at the moment. Is very sad indeed.